The cost to manage pediatric obesity alone between the 1970s and 2000 was linked to a staggering increase to the financial burden, increasing from $35 million a year to $227 million, representing a 549% increase. This alarming jump in the cost to manage obese children and adolescents acts as a sort of harbinger for the approaching storm clouds that are about to impact our healthcare financial system. Medical practitioners and epidemiologists with many years of experience treating and tracking diabetes are alarmed by the trends they are now seeing.
The incidence of diabetes has just skyrocketed in children. And that's really a disaster because we don't know what's going to happen to those kids with type 2 diabetes that have it for 60, 70, 80 years if they live that long.
The seriousness of type 2 diabetes is immense. We've been seeing it now for about 20 years, almost 30 years. Here in South Texas, we've seen a steady rise since the early 1980s in type 2 diabetes. We've been tracking that at our hospital here in Corpus Christi, and we are now to the point where we're seeing almost parity with new cases of type 1 diabetes and new cases of type 2 diabetes in children.
Dr. Barry Popkin, an internationally acclaimed epidemiologist and nutrition professor at the University of North Carolina, Chapel Hill, has been studying obesity and diabetes for most of his career. He explains the gravity of the epidemic.
40 years ago, most people across the globe didn't get diabetes until they were 50 or 60. Today, in our country, in the United States, in Canada, in England, in other high-income countries, we're starting to find children, let alone adolescents, in great numbers who are either becoming pre-diabetic or diabetic.
Diabetes mellitus is of particular concern as there has been an exponential growth of the diabetic population in the U.S. in recent decades, going from 5.6 million cases in 1980 to 17.4 million cases in 2007, and more recently jumping to an astounding 26 million American adults in 2010, according to the Center for Disease Control's 2011 report, representing a 364% increase in the overall diabetic population in the last 30 years. But most surprisingly, there are an additional 79 million American adults, or 35% of the adult population, who are classified as pre-diabetic. In total, then, there are 105 million adult Americans who are either suffering from diabetes or are at risk of developing diabetes.